Question. A 65-year-old male presents to the emergency department with sudden onset severe chest pain radiating to his back. He is diaphoretic and has a history of hypertension. On examination, his blood pressure is 180/110 mmHg in the right arm and 160/100 mmHg in the left arm. A chest X-ray shows a widened mediastinum. What is the most likely diagnosis? A. Acute myocardial infarction. B. Pulmonary embolism. C. Aortic dissection. D. Pericarditis. Correct answer is C. Aortic dissection. The patient's presentation is highly suggestive of an aortic dissection, which is a life-threatening condition. The key features in the question pointing to this diagnosis include sudden onset severe chest pain radiating to the back. This is a classic symptom of aortic dissection. Diaphoresis, sweating profusely, is often associated with severe pain or cardiovascular events. History of hypertension. Hypertension is a major risk factor for aortic dissection. Differential blood pressure in both arms. A significant difference in blood pressure between arms is a hallmark of aortic dissection, as it can indicate that the dissection has affected the blood flow differently in each arm. Widened mediastinum on chest X-ray. This radiologic finding is suggestive of aortic dissection, where the aorta may be dilated or there may be blood in the mediastinal space due to the dissection. Given these points, aortic dissection is the most likely diagnosis among the options provided. Other options explained. A. Acute myocardial infarction. While it can present with severe chest pain and diaphoresis, it typically does not cause a significant blood pressure difference between arms or a widened mediastinum. B. Pulmonary embolism. This can cause sudden chest pain and dyspnea, but it is less likely to present with a differential blood pressure and a widened mediastinum. D. Pericarditis. This usually presents with chest pain that worsens with inspiration or lying down, and is less likely to cause a widened mediastinum or differential blood pressure. E. Pneumothorax. This can cause sudden chest pain and dyspnea, but it usually presents with decreased breath sounds on one side rather than differential blood pressure or a widened mediastinum. Therefore, the most fitting diagnosis for this clinical scenario is an aortic dissection.